Welcome to the latest episode of CarePoints. I'm your host, Kenny Schiff, Chief Marketing Officer for Lone Star Communications, the Alero Solutions Group, and our latest family member, Promobix. Today's episode is part of my continuing series of conversations with my collaborators at Lone Star, customers, partners, and notable folks in the tech industry. Thanks for joining me today, and I look forward to another great conversation with my guest. I'm so excited to have as a guest today Allen Foucht, who is a nurse who works for Midmark, a long-standing player in the real-time location business. Allen is the Senior Customer Success Coaching Education Manager, and I'm going to have him start by telling us about Midmark and then telling us about himself. So, Allen, thank you for joining me today, and why don't you tell us a little bit about Midmark?
Thanks, Kenny. Midmark is just now celebrating 110 years as not only an industry provider, but now in healthcare. And Midmark focuses not only on just technology, but workflow. And that's really what we talk about with real-time location, is understanding the space between the caregiver, the patient, and the actual clinical environment.
So it's an important part of doing business in hospitals to know where people are and to give them different kinds of ways of locating themselves, both from an application standpoint, but from a communication standpoint. So tell us about you. How did you come? Give us a little bit about your background. How did you come to Midmark? And tell us a little bit about what you do out in the field.
Well, I've been pretty fortunate. I started off out of the military, just working in the emergency room, and really started enjoying healthcare and decided to go to nursing school. And soon after found myself in the ICU in different areas in the hospital, transporting patients, caring for patients, and really beginning to understand that. Soon after, I found myself in management and then eventually working on projects that had to deal with all the barriers and the issues and with throughput and clinical issues. So after that, I was fortunate enough to get a call from Midmark and say, hey, would you help us with some consulting? And then eventually end up with in the real-time location.
So that must have been a cool little transition from you. You work out in the field, you elevate yourself from kind of typical day-to-day things, you become involved in management, and now you're working for somebody who is assisting hospitals to do work more efficiently, provide a safer experience. Your perspective as a nurse is really important to our audience. We covered technology, and obviously technology is really important, but technology is as beneficial to customers as it is applied by the people who use it, and nurses are an important hospital customer. From your experience as an RN, what are some of the most pressing safety concerns that nurses face today?
The feeling of caring for yourself is not one, first of all, that I want to bring out. Nurses are taught to care for the patients, provide for the patients, and focus on them. So they really don't think about their own safety until just recently when workplace violence has escalated and they hear about it and they see it every day. So some of the main things that come to mind are, how am I going to feel safe in the workplace? Who's going to respond to me when I'm there? And what's going to happen to me if I don't have a way for that to happen?
So when we talked 25 years ago or so about real-time location systems, we thought mostly about precision tracking to know where things were, and then eventually the people thing got added on. But the whole location from a duress perspective, tell us a little bit more about the role that a real-time location system can have from a staff safety perspective and how it works and how people use it.
Staff duress really is a way to focus on how to respond to an escalating patient or visitor that's unhappy, violent, or just doesn't like the situation they're in. And most nurses caring for patients every day just come across this inadvertently, or they may know it ahead of time. But what they really need to have is a really discreet way to notify somebody, security, the unit coordinator, anywhere in the hospital, that they're in trouble and they need help. So to provide this, they don't need a phone because phones are not always available. They don't need a button because buttons aren't always in the right location. And then they find themselves, if that's all they have to call for help. And then a lot of times, help might not be around. If it's off shift, if you're in an area like radiology where there might be one person with you in the exam room, it's really important to have a way to get help. And RTLS provides that with minimal infrastructure, and they can automate messages to many different ways, to EMRs, to phones. So it's really become necessary to have a way to respond to violence.
So early on, as RTLS was deployed, the duress was something that was considered to be optional, and some customers opted for it and some didn't. Sounds like you are advocating that this is not really optional anymore. It's such an important part of what the technology can do to support an institution.
It really is. In fact, back to what your original question was, when we put RTLS in, the usual starting point was for asset management. And what we found is that if you have it in for staff duress and staff locating an asset, duress really is now one of the key parts of that, and it isn't optional because you already have the infrastructure for that. And nurses in healthcare are assaulted every day. So it is not something that can be left behind. Your chief nursing officers, your managers, and CEOs are all asking about it, and they want to care for people, but they don't always know the best way and the most efficient way. And RTLS provides that because you can focus on your care while having a way to get help when needed.
So it's interesting for me because I've been in and around this space for really since the 90s, is that this was a dream back then. Some people kind of got it to work, but here we are in 2025, and there's a lot of evolution to the platforms that make it be able to do a lot more without it being as difficult as it once was. And one of the things that has shifted over the last few years is the introduction of low energy Bluetooth that is part of an RTLS platform like Midmark. So you want to tell us a little bit about how this plays into the whole duress thing, but in general, how does it really enrich and expand what was previously really maybe not as possible?
Yeah, real-time locating in the past has been um, placing it into the environment of care or healthcare is tough because hospitals are old. Um, they've added on, so pulling wires into the hospital, it was never anything that was easy. In fact, it's very expensive because you have to go through ceilings, you have to go through different areas, you have to get the wires to the different rooms. Bluetooth Low Energy, the infrastructure is much lighter. It's much easier to do. You plug a sensor into the wall, or you use your access points by Wi-Fi to locate the staff badge, and you can see the actual location very quickly within seconds of hitting the badge. And the infrastructure, you plug it in, you have the badge, or you use the access points. You really can install it in a very large hospital within a day or two, where it usually took months, 3 to 6 months to pull the wire and get the RTLS system set up. So it's much more efficient and it's lowered the cost.
Why don't you paint a visual picture of what the experience is like as a nurse who's using, say, the duress function? So I'm in a particular unit. There's a particular incident. How does that all work? What does it look like? What does it feel like? Walk us through that.
So nurses wear the badge with their ID. So it's part of their uniform. And so when they're going about their day, they know that they have a device that they can hit the button at any time that's needed. So if I walked into a room, I'm caring for a patient, I'm turning them, something happens in the room that a family member or the patient argue, it becomes escalated in the room. I'm starting to feel uncomfortable. All of a sudden, the visitor, the patient's yelling at me, the visitor's yelling at me, the family's yelling at me. I may not feel comfortable walking over the phone and picking it up in a traditional sense that you would do for for that type of code. So all I have to do is reach up and click my button, and it's going to send an alert directly to security and to the nurse's station that I need help. I don't have to yell. I don't have to do anything else. So it's very discreet, and the discreet portion is very important. It's very different than going over and picking up the phone and actually talking into it where everybody in the room can hear you. Another situation could be is that you're in a behavioral health unit, a patient's having a tough time, they escalate very quickly, and they all of a sudden jump up and lunge at you. You have your button that you can hit right away. So it really helps decrease injuries with nursing teams and the responsiveness.
Yeah, so this is not an extra thing. Nurses will have to wear ID badges anyway. It's part of their day-to-day operations. And, in the past, people had some concerns about the visibility of all that, but now a nurse can consider it to be a part of their day-to-day operations. So as I've watched RTLS over the last 30 plus years, sometimes people deployed in piecemeal fashion. They had a specific need, say, in a surgical suite to locate equipment or other parts of the surgical process. But in general, there's been issues with institutions not looking at this more holistically over a campus or an entire enterprise. What are the issues do you see due to partial coverage that are important for an institution who's looking at this type of technology to consider?
Well, as you're talking about this, Kenny, what the first thing that comes to mind is violence in healthcare doesn't just happen in one area of the hospital. So when you think about just doing one area of the unit, or behavioral health, or just ED, or just the OR, you're really missing the point of what RTLS can do for you. People are in the hospital, visiting, and they're all throughout the environment. So if I'm in the behavioral health unit and somebody's upset with me, or I'm in the ED and I go out of the unit, what happens if I'm approached outside the coverage of the area? I don't have that discrete function that's usable. So I can only get it in select areas, and so I don't feel protected, and I don't trust the system as I should.
And obviously, from a staff perspective, one begins to potentially lose trust in the organization because the feeling is that the organization isn't necessarily looking out for my safety. And the thing about hospitals is that there's front of house, what's visible to visitors and to patients, but a significant portion of the apparatus of the hospital is back of house. There are all kinds of hallways and sub-basements and areas of the building that all kinds of personnel, nursing included, have to traverse. And so it's important from a strategy standpoint to think about the whole house, not just pieces of it. So privacy is a very important part of the whole location equation, whether it be any of us as private citizens or any of those who are workers. So the whole notion of Big Brother has always been concerning. How can healthcare organizations avoid fueling the Big Brother perception of RTLS when just in general, what are some things that you're talking to customers about in that regard?
Well, RTLS, when you talk about the big brother, everybody thinks everybody's going to try to locate me. They're going to try to find me all the time. RTLS isn't designed just for that sole purpose. It's designed to be more, to help caregivers be more efficient and to be able to find and locate things. So not everybody's always focused on or has time to just follow the RTLS and just understand where everybody is. They're using it when needed for what the purpose is. Where's this piece of equipment? Where is the doctor been in the room yet? Is there, what's going on? How many people are in the OR? Do they need another nurse in there? Those types of things. Additionally, RTLS can be behind the scenes, or it can be on a floor plan map where you can see it if needed. So there's different ways to put it together, install it, and implement it, but it's really about the efficiency and the caregiver and the provider and the nurse, and making it more efficiently so I can spend more time on care.
Excellent. So one of the things that's a wonderful thing that has happened over the intervening part of this century is that once the usability of all these technologies has significantly improved. So consumer technology has all taught us that things can work well and they can be easy to use. My 90-year-old mother is a pretty high acumen technology user, and it has to be usable. I know that Midmark has been working quite a bit on usability and also just the sense of how to weave this into the fabric of the institution's workflow and all the different people it touches. Nurses can feel overwhelmed by disjointed technology. What makes Midmark's approach to this make it feel to those people less disjointed and more integrated into how they operate, both from a workflow perspective, but also from a safety perspective?
Midmark takes the approach of from the caregiver side, not from the technology side. So when we go to market, we consider how are nurses going to use it, how are doctors going to use it, how our facilities or biomed is going to use it, what's going to make it tick for them. So when we go to market with that, we consider how are they going to adopt it and what is it going to make it easier for them? Because as most people know, 70% of technologies fail because they aren't adopted. So it has to be easy for them to use. It has to have something for them to get out of it. So what's in it for them? And again, it has to be easy implementation. And that's where we focused on that. We can get in, get it done, not disrupt the environment of care. We can make the environment of care more efficient because nurses won't have to spend 20 minutes a shift looking for items that they need, like IV pumps and all those other things, vein finders. And again, safety wise, they feel like, hey, I can use this because all I have to do is reach up and hit the button.
So Midmark has some evolving aspects to the platform. And one of the things that we've learned quite a bit of is that no one specific aspect of the technology framework can do it all. So RTLS has needed to combine multiple technologies together. So Midmark has got a IR, BLE hybrid technology that's coming. And that's got to be exciting for you because it opens up some new opportunities for the work that you do with customers. Why don't you tell us a little bit about that?
Yeah, the hybrid technology really takes the old wired approach and the BLE and combines them, except for one thing. It still doesn't have the wires. So we have a wireless infrared sensor that's put in patient rooms and out of the rooms. And then you take BLE and you put it in the rest of the facility. So again, as I mentioned, it really lowers the cost of entry. In the IR combined, with the BLE gives us that really granular understanding of where staff and items are.
And patients.
So I can use workflow to understand certain things in there. So who's in with the patient, who's not in with the patient. And on the end of that, you get that really good analytics that drives care and KPIs. But you still can understand where everything is located and get other analytics on the backside with the BLE. So it combines the granularity portion of the IR with the near room location of the BLE, thus lowering costs, but still being able to support all use cases.
Yeah, and some aspects of location platforms really need precision. So if you want to know where elements on a surgical tray are, it's not okay to know that it's nearby. You need to know exactly where it is, and the IR is something that historically Midmark has been expert at, and this becomes a way of combining a lot of your special sauce, yet make it easier to deploy and more cost effective. So let's ask a couple more questions on one more on safety, and then we're going to just talk a little bit about some sort of best practices and things that people who are making technology decisions at an administrative level at the health system should know about. So what do you think would change on the floor for staff engagement and for patient safety if every unit had access to this kind of integrated protection?
It makes it easier to provide a sense of security for staff. You can talk about it all day long. Staff don't feel like they're safe in an environment because of staffing shortages, because of where they're located, because of all these different things. And it also affects patients' perceptions, because sometimes we decide, hey, we're going to limit visiting hours because we're short-staffed, we don't feel safe. With the sense of security, it changes the hospital environment, because you have a sense of knowing that at any given time, I can get help. And it also helps on the security side. We haven't talked about that a lot. It allows security to visualize anywhere in the hospital very quickly what's going on during a staff duress incident, so they can direct different personnel and what's needed to that area, and even escalate and call 911 if needed, just by visually understanding what's going on just on the map views and seeing who's in the room in the incident.
Right. And also forensically, if something did happen, there's a lot of backup about the movements of things and people that can be referred to in the event there's legal involved or other investigative kinds of things. So I'm going to begin to wrap here. So a lot of the audience for this type of podcast would be chief nursing officers, CNIOs, IT executives, leadership in the institution who are thinking about the things that they should add on to their environment to make it be safe and reliable and so forth. And we spent a bunch of time today talking about facility-wide duress systems. If you were talking to a chief nursing officer today or one of the other leaders that I mentioned, what would you tell them about facility-wide duress and why they're really no longer just optional?
Workplace violence happens in every institution. It is not just segregated to one area of the country or one area of the city, and there's no way that you can ever know that it's going to happen. So you have to prepare for it now, and you have to provide a sense of security for your nurses, because you can use that to help nurses understand, hey, we care for you. We want to make sure you're okay, because when you get hurt in healthcare, it's usually not an easy thing to recover from. And that person's usually out of the workforce for months, which in turn affects your staffing ratios, how you can respond to different events. and you begin to lose trust from your nursing teams and your other staff. So it's not worth waiting for it to happen. It's better to be proactive.
Any closing thoughts? Anything you want to share with your peers who you work with, training and deployment wise, or decision makers? What are some things that you can offer based on your experience of working with this technology over the last few years?
Sure, Kenny. The main thing that I've gained from this and been lucky enough to be part of is that a lot of technology fails, but RTLS, when implemented right, can really help patients stay and have care in rooms longer. On average, nurses only spend about 20% of their shift on patient care. Being able to understand where people are and items are can make care more efficient, and it can decrease cost. So being part of this is just what it's about. It's about patient care and making it easier for staff.
And a company like Midmark it works with customers to provide all the other elements to that complete way of looking at workflow and safety as well. So, Allen, thank you so much for spending time with me today. And I look forward to catching up with you again in the future.
Thank you, Kenny.
Thanks so much for joining us today on CarePoints. I encourage you to hit the like button and subscribe so that you can get notified when we release our next episodes. Make sure to subscribe on your favorite podcasting service, Apple, Spotify, iHeartRadio, whatever your favorite platform is. And make sure to visit us on the web at www.lonestarcom.com/podcast. That's www.lonestarcom.com/podcast. You'll find all of our old episodes there. Thanks so much for listening, and looking forward to having you back soon.